Turning to the vetting of Health Cabinet Secretary nominee Dr. Deborah Barasa, and the nominee underwent intense scrutiny, trying to defend her competency and suitability to serve in the ministry. Dr. Barasa, who appeared to leverage on digital solutions and consultations as a silver bullet to revitalize the ministry plagued with a myriad of challenges, was pressed to explain how she would use her leadership skills at an individual level to address the challenges faced in the crucial sector. Gloria Milimu with more.
I shall give before the committee.
Thursday morning, and President William Ruto's nominee for the health docket, Dr. Deborah Barasa, was the second to face the 20-member committee on appointments to defend her suitability and competency to serve as Kenya's next Cabinet Secretary for Health.
We'll start by inviting you to make a brief introduction of yourself.
I have a vast experience in terms of policy advice, strategic direction, technical advice, and clinical practice.
Unlike the first nominee to be vetted, who had walked into a familiar territory, for Dr. Barasa, it was like walking into uncharted waters that seemingly required wit and fortitude to navigate. And in a bid to gauge her suitability, the medical doctor was confronted with the reality that awaited her at the ministry should her vetting sail through.
What are the measures you intend to put in place should you be approved? One, to curb the theft that has been witnessed in NHIF.
First of all, my approach is a consultative approach involving the multiple stakeholders. And with this, we need to conduct a situational analysis to understand the challenges, and from there, come up with interventions and action plans.
Other areas where her leadership skills were put to test involved the frequent industrial disputes witnessed in the sector and the fragile relationship between both tiers of the government in managing the crucial sector.
How do you intend to make sure that your health is really devolved and resources are taken to devolved units?
How do we just ensure that people who work in the health sector, because it's a very important sector, are taken care of in terms of their remuneration and also their welfare?
We need to work together with the unions, the doctors themselves, the interns. We need to work with the bodies, the Ministry of Education, among other stakeholders, to come up with a solution. I don't have a solution, but what I am saying is we need to have a situational analysis and be able to develop action plans following that.
I hear you talk about situational analysis. I hear you talk, I've counted them, there are 10 now. Digital platform, there are 8 consultations, there are around 7 there. You keep on using the same ones all the time. But the health sector is a big thing, big, very big. It requires a very high level of leadership. And that high level of leadership is policy. But as I listen to you, I'm not hearing you enunciate or really bring out policy issues apart from consultation.
From a leadership and a management perspective, it's always consultative. It's not a one-man show.
Similarly, she was put to task to explain how she would handle the new health financing model without the users suffering effects occasioned by the gaps highlighted in the transition process, including the withdrawal of Linda Mama program in the new health scheme that has elicited sharp criticism. Dr. Barasa, who was among 4 other nominees to be vetted Thursday, also placed her net worth at 455 million shillings. The vetting exercise of the remaining nominees for the CS positions will run through till Sunday 4th. Gloria Milimu, KTN News.
Staying with